Hi everyone, welcome to 1.3. Today we're talking about understanding the need for limitations in massage therapy. So, obviously there are some clear limitations. We're not surgeons, we're not doing surgery in the office. You can't do anything inappropriate. We are not doing anything of an adult sexual relation nature in the massage therapy office. You are not a nurse practitioner. You are not a pharmacist. You are not injecting Botox. Unfortunately, unless you are also licensed as an esthetician, you will not be doing any skin care or blackhead removals, anything of that nature. You are stuck to the manual manipulation or utilizing tools that simulate manual manipulation of the soft tissues of the body only in massage therapy. So we're going to dive into that a little bit further because there are more limitations beyond just the basic scope of practice. So you need to be aware of massage therapy's legal and ethical aspects. All right. You need those to build a successful business. You need to understand all of the legal requirements, and these requirements change based on your location. For instance, the home that I purchased is on a highway in northern Michigan because it was actually zoned as commercial and then grandfathered in as a residence because apparently it was like a doctor's office in the 1900s, which is really cool, allowing me to open the front half as a business legally, but the rest of it could still be a residence. And I'm right across the street from a church, and I'm less than a mile from at least one, if not two schools. If I wanted to open my practice in Port Huron, which is about, I don't know, an hour and 20 minutes from me, um, I would have had to fall under adult entertainment, and I would not be allowed to practice a massage therapy office in the front half of my house. It could, even if it was zoned commercial, like this property is, because it was considered adult entertainment, and you can't have it in the same building as a bedroom. And I also wouldn't be able to do it, I believe it was within 1,500 feet of a church or a school or a daycare. Uh, so I did not move to Port Huron, even though I wanted to be close to the Blue Water Bridge. So please bear in mind, depending on what city your practice is in, that city may have laws in addition to the state of Michigan. Okay, so those legal requirements change from location to location, and you need to be very, very aware of that. You need to follow practice and professional standards. All right. These are standards across the board with massage therapy and comply with privacy regulations and law. We're going to talk about HIPAA later on in this class, but please be aware privacy law is incredibly important. Informed consent is super important. Everyone needs to experience body and healthcare autonomy. Your clients need to be informed about what they are consenting to or declining in terms of a service. And make sure that you're utilizing effective communication techniques to make sure that you build that rapport and garner trust between you and your client. Okay. Obtaining a state certified license grants therapists legal authorization to practice massage in that state, but be aware that does not protect you in case of client injury or accident. Okay, you need to have professional liability insurance for that. I would also suggest having it on your business premises as well as your professional license. Understanding the limitations of your license and taking additional measures, such as having that insurance coverage, is key to protecting yourself and your practice from possible legal hazards. All right. And we need to talk about scope of practice and professional standards. As a massage therapist, you have to follow those standards to avoid legal issues and ensure client safety. That scope of practice includes soft tissue manipulation, addressing client complaints, and these are soft tissue complaints or flexibility or mobility complaints that relate to what you can do with manipulation to soft tissue. And making sure that you don't perform skeletal adjustments. You are not a chiropractor. You cannot diagnose medical conditions. You cannot prescribe medications, and you cannot perform high velocity, low amplitude thrust to joints. Again, you're not a chiropractor. All right. The NCBTMB is pretty cool. That's what offers board certification for massage therapists. The national certification, it's been renamed now. That's what I got almost 2 decades ago. But it is now board certification, and they advocate standards of maintaining appropriate boundaries. We talk a lot about boundaries in chapters 1 through 3 in our book. But we are going to discuss them over and over again in this course because boundaries have a lot to do with ethics. Following the code of ethics, communicating effectively with clients, addressing concerns or modifications, setting realistic massage goals with a treatment plan. Do not overpromise. If anything, underpromise and overperform. All right. Provide informed consent and clear client communication. All right, those are super, super important. So this is pulled from the Michigan Health Code, the Public Health Code. And massage therapist here means an individual engaged in the practice of massage therapy. There's a little bit here about polarity therapy and Feldenkrais. You can pause this to read it if you like. Practice of massage therapy means the application of a system of structured touch, pressure, movement, and holding to the soft tissue of the human body, in which the primary intent is to enhance or restore the health and well-being of the client. Notice it does not say cure. All right, it says enhance or restore. Restore is pretty close to cure. You are restoring someone back to their base level of health if you can. You may not be able to. So at the best, we're hoping to enhance or maintain. The practice of massage therapy, again, does not include medical diagnosis. Practice of physical therapy, you would be a physical therapist at that point. High velocity, low amplitude thrust to a joint, that is chiropractic. Electrical stimulation. Now you could do electromechanical, all right? That's separate. Electrical stimulation is not allowed in Michigan. And this is where you need to be careful if you move to other states to look that stuff up. I got licensed in Florida. I could use TENS units. I could use ultrasound. I could use electrical stimulation machines of all types. I can't do that here in Michigan, even though I am trained. I know how to do it and I own the equipment because it's illegal for me to do it in Michigan. It's out of my scope of practice here. In Florida, it's a health license, so it's a little bit different. So please be aware, taking the MBLEX will allow you to get licensed in 22 different states, but not every state, if you decide to move, has the same scope of practice. So just keep that in mind. You cannot do the application of ultrasound in Michigan, unfortunately, and you cannot, of course, prescribe medication. You can do external application of water, heat, cold, lubrication, salt scrubs, body wraps, or other topical preparations, as long as you don't call them medication, promise any type of health benefits, and it's not a skincare routine like an esthetician would apply. And you can use electromechanical devices like a massage gun that mimic or enhance the actions possible by the hands. All right, you can't use a TENS unit, but you can use a massage gun because that is manipulating the soft tissue like you could with percussion with your hands. All right, use of certain titles, words, or initials cannot be used unless you're licensed as a massage therapist, like masseur, massagist, certified massage therapist, et cetera, et cetera, et cetera. You guys are all going to pass the MBLEX. You're going to be amazing and you'll be licensed. So you'll be able to use these titles. I put this image up here because it cracked me up. I just want to point this out because I was looking for a stock image of massage. Please don't ever do this to your wrist. Don't ever do this to your wrist. That is so, so bad for everything in there. It's too long to explain. I will do a self-care video. Do not do that. And also, please clip your nails. All the oil and bacteria going underneath these and possibly scraping this client's skin. This is a great photograph, but it really shows some, while the photography is great, please watch what you're doing in massage therapy. If I were looking for a massage therapist and I saw that they had these long nails, I immediately would not go. That seems super uncomfortable. All right. Massage therapy, license required. There are some exceptions. There are things that you can do right now without having your massage therapy licensed if you have taken the time to learn these techniques. So, one is the use of touch, words, or directed movement to deepen awareness of patterns of movement in the body, as long as those services are not designated or implied to be massage or massage therapy. I would be careful not to call it fitness either, because usually you should have a personal fitness certification or something of that nature. These practices include, but are not limited to, the Feldenkrais method, which is amazing, especially the pelvic clock. I included that in here, even though I know you guys are going to pass the NBLEX and get licensed, because if you do not learn about this method here at Dorsey from one of your spa teachers or someone else on ground, it is certainly worth learning about, especially if you're interested in pelvic floor dysfunction and women's health. And then, of course, there's also the Traeger approach. Massage therapy exceptions also continue. The affectation of the human energy system, or acupoints, or chi meridians of the human body while engaged within the scope of practice of a profession with established standards and ethics, as long as these services are not designated or implied to be massage or massage therapy. These include polarity therapy, Asian bodywork therapy, Reiki, Shiatsu, reflexology, and structural integration, which is interesting to me because Shiatsu and structural integration, as well as reflexology, are often taught as massage therapy workshops. Reiki is energy work. True Reiki has no physical contact whatsoever, and you're also not supposed to accept payment for it. If you truly are performing Reiki, just throwing that out there, you should not be accepting payment for that, just as a standard of that practice. But that's a side story. But these are things that you can learn now before you are licensed, to sort of enhance your practice in the future when you are licensed, and you will not get in trouble for doing these. All right. There is a massage therapy board that is created to help keep up the standards of the industry and to also create a professional code of ethics. Also, a licensee shall make a written referral of a client, this is important, to an appropriate healthcare professional if the client's physical or medical condition appears to constitute a contraindication for massage therapy. All right. You aren't supposed to just refuse the client and say, hey, look, I think you may have a cardiac or kidney issue, or, I can't diagnose you. You should go see your doctor. You should ask for written consent, and then you should make a written referral. You should write down your client's symptoms so that they can take them to the doctor. You should make a written referral to a healthcare provider for your client, and also document that in your SOAP notes. All right. Another thing, when you are declining clients because of contraindications, it is unethical to allow your subjective opinions. These are like your personal thoughts, not necessarily your feelings, but things that you may think about their religion or the way that they dress or something, to interfere with them receiving legal, professional, or safe care. Your feelings may be so strong that you choose to terminate the therapeutic relationship if you find them repugnant in some way. They're being, harassing you sexually, something of that. But while they are in your care, until they have been terminated from your care, you must offer the most appropriate ethical treatment of that client. You must maintain professionalism and provide safe care at all times. Also, throwing this out there, You should retain client records for at least 7 years from the date of the last massage therapy treatment for which a client record entry was required. You should retain the record for a minor until at least a year after that minor reaches 18 years of age, even if that means you're keeping that record for like 11 years. All right. Keep SOAP notes on all of your clients, especially if you're self-employed or a contractor. Keep those SOAP notes. And this includes things like chair massage, special events, even if it's just a little half sheet of them certifying that it's safe for them to get massage, their name and number if anything happens, that type of thing. Okay. So that you have it on record that there was no contraindication that they had mentioned to you prior to doing the massage, and that you have a record of what you have done to that client, just in case anything were to happen or insurance ends up asking for something. I've had to present my SOAP notes before in a legal case that had to do with bruises that I saw on a client's body that I notated that needed to be brought up in court in a domestic violence case. So you never know what is going to occur where you're going to need these records. So please keep them on hand for at least 7 years. So some contraindications, why would you refuse a client? So there's some local ones. We talk about this in pathology. Of course, there's cuts or open wounds, bruises, varicose veins, broken bones, burns. There's some skin conditions too. Those are local. You're going to just work around that area, but you can still massage that client. However, there are some things that you need to be aware of that are total contraindications. Fever in pathology, I call this the fever red stoplight. We stop. We don't ever work on someone with fever. Contagious diseases, obviously, we're not going to work on them. Blood clots, your pathology book and some MBLEX questions call blood clots in the legs or a DVT, a deep vein thrombosis, a local contraindication. But these clots could move to the lungs, causing a pulmonary embolism. It could move to the brain, causing a stroke, the heart causing a heart attack. I personally would 100% refuse someone with a known blood clot. Like, just no, I absolutely would not massage them. It kind of concerns me that some of your textbooks say that it's a local contraindication. I happen to disagree, and I'm going to err on the side of caution in this. So I'm throwing it in here with the total contraindications, but you do you. Pregnancy, if they're in the first 3 months, massage is a no-no. If it's after the first trimester, if you are trained in prenatal massage, go for it. If you are not, I would not do so. Kidney conditions, liver conditions, you can throw people into a severe state. If there's a lot of blood flow happening and they have chemical imbalances in the body relating to either of these two very important organs. Well, I should say 3 because there's 2 kidneys. So please be aware of that. Cancer, while massage can help cancer, they need to be cleared by a medical professional in order for you to be able to do the massage safely. There are some types of cancer that can actually metastasize through massage therapy, and you could make it worse. Please be aware of that. Please be aware of that and make sure that you get medical clearance. Inflammation. Do not massage inflamed areas. It will actually aggravate it because you're bringing more blood flow to the area. If anything, I would offer ice massage in the area with very light pressure and, of course, moving distal to proximal. And uncontrolled hypertension. Massage increases blood flow. This is also why we don't put heat packs on the abdomen over the aorta or anything. We're not going to increase that blood flow with people with high blood pressure. All right. Massage and ethics. All right. All about these limitations. Ethics limits things that you're going to do because you are going to maintain your values and principles. All right. Massage therapy is a profession built on the idea of trust, and ethical conduct helps provide consistency in the professional behavior of massage therapists, maintaining the integrity of the profession. All right. Sometimes the complex nature of maintaining a professional relationship is made more difficult because the massage therapy relationship between therapist and client is inherently intimate. All right. One thing to keep in mind with this, and we're going to talk about this later on, is it's unlawful to be involved in a dual or multiple relationships with a current or former client where there is a risk of harm to or exploitation of the client. You can be in a dual relationship, like a friend and a massage therapist, but if it's going to cause harm in some way to the client, you cannot have that dual relationship. It is not suggested that you have an employer employee and a massage therapist and client relationship. That type of thing is sort of frowned upon. But if any harm comes to the client because of this relationship, it is unlawful. It's also suggested for personal relationships, you wait at least 6 months after seeing that person as a client before you begin to date them in any manner. Just throwing that out there. Massage therapists can create ethical dilemmas by overusing and underusing their power. I'm not going to talk a whole lot about that here, but you could abuse your power by showing up late, by over suggesting things, by making yourself sound more competent than what they are. You may underuse your power by not setting appropriate boundaries and not allowing your client to know what your policies are and setting clear expectations for that therapeutic relationship. All right. Boundaries are super important to establishing that therapeutic relationship and having it work. They ensure that the needs and goals of the client are being met, but they also serve the professional interests of massage therapists by providing guidelines that establish the scope of therapeutic practice and affect the client's expectations as a whole. All right. Boundaries we're going to cover, but just to go over some physical boundaries, that's respecting each other's space, modesty, draping, emotional boundaries. You are not their talk therapist, you are a touch therapist. They may have a trauma response to what you're doing. You are not a mental health professional. And if you are duly licensed as a mental health professional, I would argue to keep the two things separate because of the transference issues that can happen in massage therapy with such intimate touch, as well as the intimacy in talk therapy. Okay. You need to have self awareness if you, as a therapist, are facing emotional challenges. If your client is talking about like something like the loss of a child or sexual abuse and it's really affecting you and you're getting secondary trauma from it, you need to draw that boundary. Professional boundaries. All right. This can encompass anything around your professionalism, your abilities, how competent you are, how you present your treatment, what you're doing, how you do it, how you observe laws, your hygiene, how you dress, how you communicate with them, how you keep your records, how clean you keep your office. These all fall into there. The other one is social boundaries. So you can talk to your client for sure, but stay away from the slippery slope of oversharing and crossing an emotional boundary as well as that social boundary. If they start doing it and you feel like they're crossing social boundaries, asking too many personal questions, you can also stop that as well. Oversharing on your personal business page can be an example of breaking a social boundary. Sharing inappropriate photos on your business page of like a party that you went to or something like that, or greeting your client out in public and letting people know how you have met that client is definitely crossing a boundary. All right. So I know we've gone a little bit above and beyond here with the limitations. Please be aware of scope of practice, and I will see you guys in 1.4.